at the site. Yes, the Brewy, because that's patency. The others are what? Neurovascular checks, yeah. And we wanted patency, didn't we?
Yes.
So that was your keyword there. 18's 81%. Always look for your keywords in your questions. All right, this patient's in early stages of renal failure. Which of the following urinary patterns would the nurse most accurately associate with the client's diagnosis? What is renal failure characterized? What is that phase that occurs right after the initial insult?
Oliguria.
Oliguria. Yep, oliguria. And then we have diuretic, and then we have recovery. 19 was 96%. All right, the doctor gave a fluid challenge to a patient because they've been having some urinary problems. And so they gave that. So if you're giving somebody a rapid infusion of fluids that you think they may have a problem with their kidneys, what should you assess? Pedal edema, skin integrity, lung sounds, or mucous membranes?
Lung sounds.
Lung sounds, because you could put them into pulmonary edema or heart failure. Number 20 was 78%. Let's see. We got a client that has an iliac conduit. They said their skin is raw and irritated. What should you do? Empty the appliance more frequent. Increase their oral fluids, leave the appliance off for 1 to 2 days, or remove the appliance and inspect the skin.
The last one.
You want to inspect the skin, don't you? You want to look at it, make sure it looks okay. The thing is here, you got to be able to assess the patient. 78% of you got that. All right, 21 was 71%. So far, we've only had 2 that was less than 50. All right, we got a problem with sensory perceptual alterations. So that means something they can't feel, they can't, maybe they got some numbness going on, maybe they got confusion, irritation. This is related to central nervous system changes induced by uremic toxins. So remember, uremic toxins go to the brain. So what's your intervention that you should be doing for a patient if they're having symptoms of sensory perceptional alterations? Because where's the uremic toxins come from? What's building up in the bloodstream?
Protein.
The urea, right? That comes from the what? Somebody said it.
Liver.
Not the liver. Well, it's converted in the liver to urea, but it's actually coming from the food that you eat, right? The protein. So if a patient already has problems, you want to ensure restricted protein intake, right? That the physician has already prescribed to prevent the nitrous product accumulations. So that's looking at nitrous and uremic toxins. So that's your keywords there to put those 2 together. 22 is 90. Urolithiasis. What's your highest priority? Immediate after admission. Ineffective health maintenance, pain, infection, or diarrhea?
Pain.
Pain. That one should have been 100%. And it was 90. All right. 23 is 78%. Patient just had a catheterization immediately after the patient voided, and we obtained 30 milliliters of residual urine. What's our next step? Restrict the intake output, notify the physician, document, or continue the catheterization routine after each void.
Document
Document it, and then just can let the doctor know, right? Because you may not need to cath anymore. Chapter 24. Question 24, 96%. Let's see. We're noting the amount and color of the urine with urolithiasis. Standard precautions are being used. What's your next action? Discard the urine, add the urine to a 24-hour collector, save the urine for physical assessment, or strain the urine. Strain, yep. That one should have been 100% as well. And that one was 96. Someone missed that one. All right, the next one is 78%. Globular nephritis. What's the urine sample of globular nephritis patient look like? We talked about this one too. I stressed this one really heavy because they're not able to filter what out?
Protein.
The protein, yeah. So it should mostly contain protein. Yep. Your other choices were calculi, E. coli, or platelets. All right, 26 was 81%. All right, we got a patient had a heart attack, now developed acute renal failure. They want to know why. Your best response is, all right, what's the problem when a patient has acute renal failure? Go ahead. Somebody was fixing to say something. Go ahead.
Oh, it's because decrease the blood flow.
Yeah, it's interfering with their blood flow, so they have a decreased amount of blood flow. It's not that they had a blood clot that formed to the kidneys. It's not that they have structural damage to the kidneys. It's not an obstruction of the urine flow from the kidneys. It's because they have decreased volume. 27, 50%. We teetered on this one. Let's see what this is. Therapeutic measure not to reduce potassium levels. Not to produce. You had K-exolate, glucose and insulin, and sodium bicarb. So you should have known that 3 of them actually would reduce the potassium level, and so therefore only 1 should have been your answer, and that would have been sodium bicarb. That was a simple flashcard. All right, 28 was 68%. Let's see. Oh, this one is fluid volume excess. What would that be related to with acute renal failure? What would it result in cardiovascular complication of? A patient having a normal sinus rhythm, a patient having heart failure, acute myocardial infarction, or heart block. Fluid volume excess. What are they going to go into? That was your person, remember, when you looked at that for fluid volume?
Is it heart failure?
It would be heart failure, yep. All right, 29 was 81%. Oops, wait a minute, come on. It didn't open up. All right, what care should you provide following an intravenous pyelogram test? Keep them NPO, check for a gag reflex, encourage fluids, or maintain bed rest. Anybody remember? What did we just give the patient that just had an intravenous pyelogram?
Wasn't it fluids? Give fluids?
We're going to give fluids because they got contrast. We want to flush that contrast out so they don't go into acute renal failure. All right, next one is 96%. This one is here. It's talking about your patients in renal failure. And the erythrocyte count is important because what are the kidneys not manufacturing?
Erythropoietin.
Erythropoietin, absolutely. Okay. The next one is 96%. So probably one person missed this one, looks like. Immunosuppressants are continued how long after kidney transplant?
For life.
For life, yep. Not a week, not until the kidney's not rejected anymore, and 24 hours after transplantation, or your other answers. The next one's 53%. Polyuria phase, what's your intervention? It's most important. You want to make sure they're getting enough carbohydrates, encouraging coughing and deep breathing. That has nothing to do with renal failure, so no one should have chose that one. Provide pain relief measures, or are you going to limit fluid intake? Because what are they not able to make in polyuria phase? Urine. So what are they doing with fluid?
They're retaining.
They're retaining it, so you want to definitely limit their fluid intake. All right, the next one is 90%. All right, diabetic neuropathy. Why do they need smaller doses of insulin?
Because they're not, is it secreting it or?
Yeah. They
Yeah.
can't break it down and they can't secrete it. Absolutely. It's not that insulin is more potent than it used to be. It is, but it's because the kidneys can't break it down and get rid of it. You have probably decreased the amount of food you're eating, or best if you spoke with your physician. All right, 34 is 87. Diagnostic tests, most indicative of renal failure. This one should have been 100%. Hematocrit, uric acid, serum creatinine of 4.2, or blood urea nitrogen at 40. It says indicative. The creatinine, yep, not the BUN. I had some people pick the BUN. All right, next one is 84%. Let's see, we got globular nephritis. Which type of failure is this? Pre-renal, intrarenal, or post-renal? Because where is your problem?
Oh, okay.
Somebody's got their microphone on. Where is the problem when it becomes globular nephritis?
Problems in the nephron.
It's in the nephron, yep. So it's where? Pre-renal, intrarenal, or post-renal?
Intra.
Intra, because it's within, yep. Oh, got 100% on this question. See what this one is. Self-cath for urinary tract infections. And what instructions related to antibiotics should the nurse give to the patient? Take them until they're gone, right?
Right.
37 is 87%. Y'all must be wore out, and we still got 2 more days to go. Renal calculi. Patient wants to get up and take a walk. What are we going to do?
We allow them to walk.
Assist.
Yep, we're going to
Help them.
get it. It's safe for you to ambulate once a day. Stay in the bed. It's better for you to remain in the bed. Walking is good for you. Let me help you up. Yep. All right, 100%. You got the next one's 100% too. Renal failure for fluid overload assessment. Increased blood pressure, edema of extremities, crackles in the lungs, increased blood pressure, flattened neck vein, signs of shock, decreased blood pressure. Well, no, you can strike that one. Apprehension, postal hypertension, you can get rid of that one. And they're not going to have flat neck veins. They're going to have distended ones. So all that's left is hypertension, edema of extremities, and crackles in the lungs because they're in fluid overload. 100%. Good job. Renal failure, recognize single best determinant of a client's fluid volume status. What is that? What are we going to do daily?
Weights.
Weights, yeah. All right, the next one is 84%. Complication following a renal biopsy, polyuria, infection, bleeding, or urinary obstruction.
Infection?
Nope, it's going to be bleeding, remember, because those kidneys are very vascular. So we worry about internal bleeding. Remember, they're going to have a Foley, and we're going to watch for hematuria. And if they have hematuria, we should report it.
All right, makes sense.
93% on the next one. This one, once again, is about a fistula. Which information is important to provide for the client? Is the client going to be using a stethoscope for auscultating the fistula is contraindicated? No. The client feels best immediately after the dialysis treatment? No. The client shouldn't feel pain during initiation of dialysis. They're sticking needles in there. They probably do have some discomfort. Or taking the blood pressure readings on the affected arm can cause clotting of the fistula.
The blood pressure's on the.
We don't want to do any blood pressures, right? We don't want to do anything to that arm that's got the fistula or the graft because we don't want to clot it off. We want to make sure it's patent. All right, the next one's 93%. When they're like 93%, it's probably 2 people have missed it. All right, we got a patient. We want a nursing diagnosis for our patient undergoing peritoneal dialysis. Are they going to have a disturbed body image? Well, they could. Are they going to have a feeding self-care deficit? No, we can eliminate that. Are they going to have a fluid volume deficit? Or are they going to be at risk for infection?
Fluid volume deficit.
Risk for infection is PD, right?
Yeah.
That one's the most important. And then we worry about volume. They're going to have volume depletion, yes, but the biggest thing there is going to be that infection. All right, because the aseptic technique, 43, 100%. Kudos. We're almost done. All right, got a nephrostomy tube. What do? Keep the collection bag taped to the abdomen, limit the fluids, ensure the tube's not kinked or clamped, or remove and clean the tube once a day. I hope you're not doing the last one. If you are, you're going to be in real dire need of malpractice insurance. Yeah, make sure it's not kinked or clamped, because what will it lead into? If this tube ends up being kinked or clamped, what's going to happen to that kidney?
It's going to obstruct from backflow or something.
What's that disease process caused, or that disorder that can occur if you don't let the urine flow out?
Is it hydronephrosis?
There you go, hydronephrosis. Very good. All right, question 44 was 90%. This is a medical patient just came back from dialysis. They're bleeding. You're in the room, they're bleeding. What are you going to do immediately? Take their blood pressure, notify the RN, apply pressure, or call the physician.
Apply pressure.
Apply pressure. Yep. And then get somebody to take the blood pressure, call the physician, and you need to let the dialysis nurse know. 45 was 90%. I think this is like 2 or 3 people maybe have missed these when they're 90. I think it might be maybe more. All right, we got impaired urine elimination. They have a skin problem. What are we going to teach them? What's our planning? It's because of they're going to have extreme oiliness, reduced perspiration, loss of skin turgor, or pronounced itching.
Itching.
They're going to have itching because they have uremia and they have phosphate being deposited on the skin. All right, 46 was 78%. All right, we got a patient, we're checking for residual amounts because patients experiencing urinary retention. Which of the following would be most important? Record the volume of urine obtained. Absolutely, we would. Set up routine schedule of every 4 hours to check for residual urine. Yes. Check residual if the client reports the urge to void. No, you always check after they void. Or can we do a bladder scan decline immediately after the client voids?
Bladder scan.
We want to do the bladder scan after they void, and then we can record, and then we want to make sure that they continue on with their schedule. All right, 78% on the next question. We're almost done. Just trying to get done with this. All right, we got a patient on dialysis. When do they go on dialysis? AEIOU, remember that? So if their acid-base balance was off, metabolic acidosis. If their electrolytes were imbalanced, hyperkalemia. And if they were fluid overloaded, okay? The other one was creatinine level of 1, that's normal. And hypokalemia, no, that's low potassium. All right, 40% on the last one. So we only had 3 questions on this urinary exam that was below 50%. All right, this was snacks. Remember I told y'all to go back and look at that chart about potassiums? Remember I said a lot of the juices will have potassium in them, and also citrus fruits. So your nectarine, your tomato juice, and your bananas were high. So those would have been eliminated because their potassium level is elevated. Your other choices were cranberry juice. Cranberry juice doesn't have a lot of potassium, and neither does a gelatin dessert. Gelatin dessert's usually made out of water. 49 is 56%. This one's a patient just had the extracorporeal shockwave lithotripsy, and you're telling the patient what they should be aware of, their instructions. They can have bruising. They may have some back soreness. They may have some blood-tinged urine, and they need to increase their fluid intake. It has nothing to do with an antibacterial dressing because there is no incision, okay? It's just a sound wave that's going through a water cushion. So there would be no incision on that one. All right, the last question, 78%. This one is the patient has diabetes mellitus, renal failure begins, they're beginning hemodialysis. Which diet is best on days in between dialysis treatment? Is there no restrictions? Low protein diet with unlimited amounts of water? No protein in the diet and use of salt substitutes, where you can eliminate that one because they're not going to be able to use salt substitutes. We're not going to give them unlimited amounts of water, and they are going to have restrictions. So 3 of those are eliminated immediately, and the last one left is low protein diet with prescribed amount of water. So do your process of elimination. Think it through when you're looking at your questions, okay? All right. I did post on D2L that there are a couple of little videos you can go into F.A. Davis and look at before Monday's lecture. And it's just kind of a review on the blood flow through the heart. It talks about blood pressure. One of them's about the conduction system. If you're not real familiar with that, you can review that. Also, I put in there about I put urinary in there for renin, angiotensin, aldosterone system as well. There's one on there about preload, contractility, and afterload, and that's going to be important because we will hit those topics. Those are cardiac terms that you will need to know for the test. So those are just a few videos you can go into F.A. Davis and look at. Thursday, Group C will be with me for clinical. We're on campus. And then everybody else will have an assignment. I already got it ready. I just have to post it. Okay, that's a 9-hour clinical day, so that means you're going to have quite a bit of work to complete by 4 o'clock. So you need to get up and get started so that you're not lacking anything. So you're not missing any clinical hours, because some of you are already missing clinical hours because you're not completing your assignments when they're due. All right, and you have to have a certain amount of clinical hours to be able to sit for boards. So keep that in mind. And your clinical hours accumulate from first to second to third. All right. So if you've already missed hours in first, that's adding to second. And then if you miss in third, that will add as well. So you could end up making up clinical hours, and you don't make those up until after you graduate. Okay. So kind of keep that in mind. So if you've been missing clinical or missed some work, make sure you're getting your work done and get it turned in on time. All right, anybody got any questions? Good job overall on this exam. Anybody have any questions? No? All right.
Sorry, I couldn't get to my button.